So in a past video, I talked about the theory of constraints, which states that the value that you can give is limited to the weakest link. As the proverb goes, the chain is only as strong as the weakest link, and that is essentially the theory of constraints. So if you have a restaurant that is serving fantastic food, but it smells like rotten eggs, then that is the constraint, and the value that the customers of that restaurant will experience is going to be severely limited by the constraints. And if the restaurant were to focus on improving the quality of the food, they would experience diminishing returns because you can only push that so far, and the amount of research, time, and energy it takes to work on that and would have marginal increases in value for the actual customers there. Whereas if they did the work of making it not smell like rotten eggs, then they could increase the value drastically without having to experience diminishing returns. So we talked about the theory of constraints, and we also talked about the five stages of the patient journey, which is finding a practice, the first visit, treatment, recurring care, and then departure. And within those 5 stages, there are 6 drivers of value. So we have efficiency, simplicity, risk reduction, fun and image, principles and values, and convenience. And so if you make an array where you have the 5 stages and the 6 drivers of value, you get 30 different cells. And we have to go through each cell asking the question, okay, at this stage and at this driver, is there anything blocking the value to that driver? So at the finding a practice stage, is there any blocks to convenience or any blocks to simplicity? And we go down and do it for all 30 cells. And the question is, how do we prioritize what we fix and what we kind of push aside? Because we don't have all the time in the world to fix everything, and we certainly don't have the resources. So we need a heuristic for figuring out what is the constraint, what is the main constraint, and what should we focus on first. So after you identify all the blocks to value, all the constraints, then you have to ask 2 questions, which is relative to your ideal patient. Because you may have many different types of patients who come into your practice and experience the journey, but have very different experiences because they have different belief systems and mindsets. So the question is, for your ideal patients, is this a severe block? Well, we should first be asking in that array where the gaps are for your ideal patient. And then once you identify that, then you ask, what is the severity of it? So is it something that's very mild and it's just a small inconvenience? Is it a medium, a bit more serious? Or is it critical, meaning that if they experience this, that it's going to severely limit the entire experience as well? And then we ask the question, so that's one dimension of weighing that constraint. The other dimension is this something that all ideal patients will experience, or just some of them, or very few of them, right? So we get the severity, and we also get the volume when it comes to the ideal patients who will actually experience it. And so we start with severity. The things that are very severe we want to address. Even if only a few number of patients, for example, come into contact with that, it can be severely limiting for those ideal patients. It can lead to things like negative reviews, and just spread outward negativity that we can avoid by addressing the severe ones. And then, of course, from severe, you want to address the ones that almost everyone experiences, then the one that most people or some people experience, and then the one that very few people experience. And then we move on to the more milder cases, or the more medium cases of severity, and then the milder cases. So we don't have all the resources to do everything, and it's important to focus on the constraints, because if we focus on just improving things, we're going to experience diminishing returns. And to know what we have to focus on, we have to rank them in order of how severe it is in terms of blocking value to the patient. Figure that out, and then we get into addressing it. And we'll probably get into addressing it in a different video, but that's it for today. Hope you enjoyed it. See you guys in the next one.